Interesting though, when the GP says, what can I do to help? What can he do to help?
So a GP can give painkillers. It is very much a multidisciplinary. If you don't mind, I'll just change the slide. Yeah. We'll go through the Baton scores shortly. But if we look at this slide here, we can see that it is a multidisciplinary treatment. So you need counselling to learn about your condition and to learn to accept it. You need painkillers. That is very important because people have to have a good quality of life. That was one of the things that my GP had a long chat with me about was, you need to take painkillers. And I wasn't very happy about it, but it did make a difference.
And do painkillers work equally well with
No.
EDS hypermobile patients?
That's the big problem. It doesn't work particularly well. So we, through trial and error, came to a combination that worked for me, but that doesn't mean it's going to work for the next person with EDS. So right now I'm waiting for the pain clinic in Denmark to come up with a plan, because unfortunately the medication I was on in Scotland is not available in Denmark.
Yeah.
So.
What's the pain mechanism?
It's a good question, isn't it? I mean, we know about the pain gate theory. We know about how chronic pain changes things in your brain.
Yes.
And when you have pain all your life, you become more susceptible to small nociceptive inputs. So, So, but who knows?
Why is it painful?
It's painful because of the injuries. It's painful because you constantly injure yourself. You overstretch the tissue. Your muscles work harder, because your ligaments are not holding everything together. Clumsiness was my biggest problem as a child, even as an adult. I mean, it was a running joke when I was at university that oh, here goes Elisabeth down the stairs again. And they heard me fall many times. And so I probably sprained my ankles 50 times, and eventually they decide that that's not fun anymore.
Yeah. Okay, let's go back to that slide that we had up a second ago, because when I looked at it earlier on, I'm not entirely sure where you enter this cycle.
Yeah, as a chiropractor, I would think we probably go under the physical treatment.
Right, so somewhere down here is where your patients are
muscle strength, muscle endurance, proprioception. We can help. We have to be a little bit careful with spinal manipulation because it's actually contraindicated in the WHO guidelines. Right. Although I think the WHO guidelines are from 1995. So
these are the WHO guidelines?
Yes.
Yeah, okay. So do you know if the NICE guidelines are different?
I'm not sure they've been updated, to be perfectly honest. Yeah. Okay. So spinal manipulation is a contraindication in Ehlers-Danlos syndrome. However, you can use non-force techniques. You can use mobilization. You can use lots of good techniques. I mean, I benefit extremely well from craniosacral therapy and osteopathic type treatments. Yeah. But now and again, when joints lock up, best thing is to get them loosened up. But you have to be careful because they don't have the same anatomical end range as normal people do. So your specificity in the adjustment needs to be very, very spot on and very careful.
You heard me mention Laurie Hartman's course earlier on, and I'm always amazed and impressed when he comes along to teach that, because he uses so many different levers to lock up a joint, the actual range of motion of the manipulation is very small indeed. Yeah, very fast, but very small, which presumably is helpful because you're not trying to stretch tissues.
And that's how I practice as well.
Yeah. Yeah. What else is going on in this chart here? We've got behaviour therapy at the top there.
Yes. So I think learning to understand how to control your anxiety. There's lots of tools you can work with a psychologist or a psychotherapist about. You can do breathing exercises, or you can do mindfulness. I mean, there's lots of things. Learning to accept that you have a chronic disorder is probably the number one thing, and that's hard to get your head around, because you want to keep finding a cure. You want to believe that it gets better, and I'm very much a believer in that. And I am better than I was 10 years ago because I've learned to modify my lifestyle and my behavior.
You're medically trained. You've done a lot of research into this, and while it can't be much fun to realise that, you can understand that. Yes. For a lot of patients, I think it's very hard to understand that medicine doesn't have an answer.
Absolutely,
let alone a one-click answer.
Absolutely, that's one of the things I always talk to patients about is, medicine is not an exact science. It's very much a trial and error, and let's see if this works. And if it doesn't, we'll try something else.